Namaskar. Coronavirus has spread globally to 172 nations, infecting more than 245,000 people and killing more than 9,200 people and blemishing the global economy. The epidemic is no less than the painful period of World War II, 2008 financial crisis, which is recession, and 1918 Spanish flu. The total number of registered cases in India is 360, still counting, and the unregistered cases would be overwhelmingly high. The central government of India, state government of India, doctors, nurses, people involved in the medical industry of India, police officers of India are magnanimously fighting against the COVID-19. The decisions taken by the central government of India and the state governments of India, like shutting down the schools, colleges, malls, and imposing Section 144 in few localities of India, and Janata curfew, all these decisions needs invaluable appreciation. It's a great job, no doubt at all, invaluable appreciation. But there is one thing, the government of India, Prime Minister's office, PMO, is missing. If they don't focus on it immediately, then there are chances of 5,000 plus coronavirus positive cases in literally no time via the prisoners of Indian jails. I repeat, prisoners of Indian jail. To give a cut of our jails, we have got 1,412 jails. Plus also because of fewer under construction. These jails include everything: central jails, district jails, sub jails, women jails, special jails, open jails, Boston School, all of them taken together, 1,412 plus. The occupancy rate of that, these 1,412 jails can accommodate 3,80,876 people. 3,80,876, I can say slightly one more plus for this. But the present occupancy rate is 114%, which means the number of prisoners in the Indian jails are 4,33,003. 4,33,000 plus. 114% is the occupancy rate, which is huge. At this point of time, they should not be like that. Keeping aside the fact that in these numbers, 13% of them are above 50 years, which is 56,290 people. I'm keeping aside that fact. But the very important thing which we have to focus is, among all these people, 75,000 plus people are suffering either with HIV, human immunodeficiency virus, or hepatitis C or tuberculosis. All these diseases, basically their immunity system would be very low and they are prone to attract the coronavirus and they are prone to even spread the coronavirus at a fast pace. This is a bad sign. If I take an example of the HIV, right, the robust of the immune system of a person is defined with the help of CD4 count. CD4 means cluster of differentiation 4. This count is simple language where you can understand. This count, if the CD4 count of any human being is between 500 to 1600, this means they've got a healthy immune system. It is 500 to 1600 cells per cubic millimeter of blood. Very professionally if I explain. In short, 500 to 1600. Now, if the value is less than that, if someone suffering with the HIV, have the disease HIV, virus HIV, now their CD4 count is between 5, if they're under medication of ART, antiretroviral therapy, it's still they're in a safe zone. If their CD4 count is between 500 to 1600, but the CD4 count is less than 500, it's danger. If the CD4 count comes to less than 200, this means they are moving from HIV to AIDS, acquired immunodeficiency syndrome. They have to get diagnosed for that. Now, the first thing which the government of India need to order for the prisoners, right, people who are managing it, is all the people who are suffering with these diseases, they have to be tested. Their CD4 count has to be tested. If the CD4 count is less than the values, whatever is said, less than 500, they should be isolated separately. Yes, I spoke to a couple of Assistant Inspector General of Prisons. These people, they have separate wing, separate block for the people suffering for these diseases. But all of them are together again. In one cell, there would be 4 people, 5 people, because the occupancy rate is 114%. Now, these people should be kept individually in one cell, first thing. Second thing, whoever have entered the prison in the last 3 months, all of them must be tested for this virus. Coronavirus, are they turning positive or negative? Because they entered inside, and people with the low immunity system had a word, if even one person has got the virus, it's going to be very dangerous to all the prisoners inside. So the people who have entered the last 3 months, 2 months before itself, I had a video stating the coronavirus impact on Indian state. I said very clearly, all these things are going to happen in these states with a clear logical explanation. And the same thing has happened. Now, if the government of India won't work on this particular angle, we'll immediately get 5,000 plus cases, please, because World Health Organization, Human Rights Watch, CDC, Center for Disease Control and Prevention, everyone is hinting that these section of people are prone to get this disease at a faster rate, are also prone to spread this disease at the faster rate. It's very, very important to isolate, as we can see, 114%. Right? Let them have a new buildings aside, hire the whole hotels for some time, and keep these people separately until this epidemic is at least under control, at least we get a cure. One thing. And see the risk parameter what the police officers are carrying. These police officers come across this, they come in front of these criminals, they have a direct contact. Definitely they would have came in direct contact. They've carried them to the judicial system, to the courts and all. So you have to really take care of how many people have actually came in contact, which is very, very sensitive stuff as far as the prisoners are concerned. Even the worrying part is the police officers. We are only clapping for the doctors and nurses, please. They are actually at a higher risk. These police officers who are actually dealing with these prisoners and all, they're at a much higher risk of getting this disease. So as advised, even the Human Rights Watch has advised the UAE government to immediately release, because Indian government at least give the medication to the people suffering with these things, free medication inside for these prisoners. But when you talk about the places like UAE, they don't give that particular medication also. The Human Rights Watch has advised them to immediately release. So same if you apply here, since the occupancy rate is very high, 114%, people, the prisoners whose imprisonment is going to end in a couple of months, it's better to release them now itself. Yes, because at least you are taking care of the occupancy rate, you have more space for the people to accommodate. They will be pushed when I have a word with few people as a part of my research, in just 100 to 1, I can say a 500 square feet big cell, some 200 people will be inside. There is a huge chance of this, the virus getting spread in the Indian jails. It's very, very important for the Indian government to work on this. And I am clapping along with the doctors and nurses, for everyone. I am also clapping for the honest police officers who are really risking their life as far as this disease is concerned. And it is over to the wisdom of the government of India, Prime Minister's office, to implement and to take care of these prisoners immediately, in stopping the spread of, because 5,000 plus cases could turn positive if this has not been worked immediately. In my next episode, I will be focusing on the economical angle, what extra support the government of India can give to the other people who daily wages, how they have been suffering if the lockdown continues for one more month. Nandri, Vanakkam.